Hi friends, today I'm going to do a role play regarding a patient who complains of headache and comes in accident and emergency department. So let's see how we can do it. So the setting is accident and emergency. You are speaking to a 31-year-old man or woman who is complaining of a severe headache and is demanding medication for pain relief. He or she is clearly distressed and seems to be in a hurry. So the task is take a relevant history of the patient's condition, the onset, triggers, severity, etc. Inquire about the patient's nature of work. Explain your preliminary diagnosis of a migraine, probably triggered by stress. Persuade him or her to wait for 30 minutes to see one of the doctors. Reassure him or her and explain why it's best to wait and see a doctor. So, the settings we have to understand the role play card clearly, then only we can perform well and attain the required score. Otherwise, if we misunderstood or we miss some details, it can affect our score. So, let's see how we can do this role play card. Here I included that interlocutor card also to see how they have to respond to your task card. That's why I just showing. So we will move with the nurse role. So we can start. Good evening. I'm Sarah, one of the registered nurses who is working in accident and emergency department. I can see you look so distressed. Could you please tell me what's the reason behind? Then they may say, I have an excruciating headache on the right side of my head. It feels like someone has gripped the right side of my neck. I'm running a bit late for work and just want a tablet or injection for pain relief. Oh, that's terrible. I hope you don't mind that I need to ask you a few questions regarding your headaches before prescribing a medication. May I do that? Sure, go ahead. For my documentation purpose, could you please tell your name? Okay, my name is Jane. Okay. So, Jane, is the pain on just one side of the head? That's right, on the right side of the forehead and above the right ear. And how severe is the pain? On a scale of 1 to 10. How would you rate your pain, with 1 being the lowest and 10 is the worst pain you have ever experienced? Oh, well, I would rate it 10. It's crippling. Oh, that's a pity. I can sense your feeling, Miss Jane. Nothing to be worried. That must be really difficult to cope with. Could you tell me if it's a throbbing pain or a dull or sharp ache? Well, I would describe it as throbbing. Okay. Is this the first time or you have had them before? No, this is the third week. They come at varied times, almost twice a week. So, what are you saying is that you started getting these headaches about 3 weeks ago? And you have had at least 2 episodic attacks every week. Is that right? Yes, that's about right. And during these episodes, how long did the pain last? Well, it lasts between 15 minutes to 2 hours. It's quite persistent and the pain gets more intense with time. Alright. Is the pain accompanied by any other problems? Well, it's usually make me nauseous and dizzy, but only until the time the headache lasts. Okay, Jane, thank you for sharing this information. Is there anything that alleviates your pain? Yes, the pain subsides with Tylenol or sleeping for 1 to 2 hours. Okay. Could you tell me if anything exacerbates your pain? Yes, I've noticed that sunlight from my office when I work at my office, it can affect could you please tell me what type of work you do? I'm a teacher and When I have some stress visitor exacerbate my headache. Oh, I can sense your feeling, Miss Jane. Anyhow, there is nothing to be worried. We are here to support you, okay? Then, all right, based on your consultation today, your symptoms are consistent with a migraine. You can see a doctor here in about 30 minutes who will be able to confirm the diagnosis and prescribe some medications. What? What do you mean? I just want some medication so that I can get back to work. I have some crucial work commitments today. These are the exam time and I have a lot of works to finish. So I cannot wait for the doctor. Could you please tell me? And could you please give me some medications right now so I can alleviate my pain and go back to my work? See, Miss Jane, I understand what you are saying. However, your health is our utmost priority. If you do not seek the right treatment at this stage, you may continue to experience severe pain in the future, which will interfere with your work. Therefore, what I recommend is that you consult a doctor today itself so that he can prescribe the right medication and suggest if any lifestyle modification is required. Oh Lord, I don't know what to say. I cannot wait for the doctor. Don't you get it? I have an important meeting today. Well, Miss Jane, I do understand your situation, but as I mentioned before, you have to consult a doctor today itself. Could you please wait at least 20 minutes? He's consulting another patient right now. Then it's okay. I will wait for him. Are you sure he will come within 20 minutes? Of course, he will be here within 20 minutes. Thank you, Miss Jane, for understanding and sharing your informations. Please be relaxed and be wait here, okay?